My name is Andrew Gray. I'm a professor of clinical anesthesia at University of California, San Francisco. Well, I did my residency in anesthesia at UCSF, where I am currently. I did my medical school down in San Diego. I have a background in research. I have a PhD in physiology. But my main interest over the last decade is peripheral nerve imaging with ultrasound and how that might be used to guide interventions. The peripheral nervous system has always fascinated me. I've always had this interest in pain management, especially acute pain management for patients undergoing surgery. So to me it was a very enlightening and revealing moment when I realized ultrasound could be used to directly image peripheral nerves. It's a huge advance in the field, and that's led to a lot of ultrasound guided interventions for acute pain management, and that's what the book is all about. It's a book that was first released at the 2009 ASA meeting, and it's an atlas of ultrasound-guided regional anesthesia. And it details how to do procedures to control pain management, all the way from basics of ultrasound, the physics of that, and all the artifacts you can see, all the physiology and underlying peripheral nerve anatomy. And it builds from there all the way to the interventions and the more common block procedures that we do, where we inject local anesthetics or other drugs to control pain. There are advantages of the book. It has incredibly detailed sonograms that really pick out all the important nuances of ultrasound anatomy and also some of the fundamental principles. And it covers a lot of different material in the print book format. But in addition to that, we've gone further. We've got a whole set of movies which have about a 4 or 5 minute run time detailing various procedures, and there's about 10 or so currently of those. Those are very popular because there's a very dynamic nature to the procedures that we do that's reflected well in the movies. Elsevier and I worked very hard on producing those. It was a combination of our footage and our mock-ups of the various procedures, but all the editing and the voiceover. It's a real production to produce a final film like that in a way that's good for education, but together with Elsevier we managed to do that. There's a couple other interesting features. I think there's a lot of really good basic material in the book on ultrasound anatomy of basic structures and really how to identify all the basic structures that you need to identify to do these procedures. There's also a big emphasis on safety, and there's a very large set of chapters on safety, which is one of our cardinal missions in anesthesia. How to make these procedures not only more safer, and also, of course, more effective. But that's a big part of the book, is just working on the safety features. There's also a lot of self-assessment tests. So if people want to look at whether or not they've learned things, they can take the tests at the end. And the latter points I've mentioned are, I don't know, I feel like they're very strong. I'll let other people decide. But I'm very happy with how it turned out because it's very comprehensive and covers a lot of different principles.